Hey guys, welcome to Surgical Utopia. Today we will be discussing about calcifying odontogenic cyst. This is a developmental lesion that comes from odontogenic epithelium and it is also known as calcifying cystic odontogenic tumor. It can appear in any location in the oral cavity, but most commonly it affects the anterior part of the mandible and maxilla, and most commonly it occurs in individuals lying in the age range from 20s to 30 years, but it can be seen in any age. Most calcifying odontogenic cyst appears asymptomatic and they are normally presented as painless, low growing mass on the mandible or maxilla, and it occurs mostly in the front region of the mouth. The symptoms include swelling in the mouth, both inside the bone, in the tooth bearing areas, and outside the bone, in the gingiva. In cases where the lesion is occurring in maxilla, the individuals might complain of nasal stiffness, epistaxis, and headache. The impacted or displaced teeth are often found due to calcifying odontogenic cyst. The diameter of the cyst ranges from 2 to 4 centimeters and swelling pain may be present. Intrabony expansion may produce hard bony expansion and may perforate cortical bones, and it can also extend into the soft tissue. Calcifying odontogenic cysts are often believed to be arising from odontogenic epithelial remnants that were trapped within the bones of the maxilla and mandible or gingival tissue. It is associated with the impacted and unerupted tooth. Radiographically, calcifying odontogenic cysts are usually discovered within dental radiographs. They will appear as unilocular, multilocular, or mixed radiolucency with the radio-opaque deposits of different sizes and opacities. Irregular calcifications may be present in some cases, and there may be often located in a periapical or lateral periodontal relationship to the adjacent tooth. Histologically, epithelium of stratified squamous cells are seen, which is 5 to 8 cell thick. Focal areas of stellate reticulum-like cells are seen, and near the basement membrane, ameloblast-like cells may be seen. Three types of calcifying odontogenic cysts may appear. Type 1A, which will have ghost cells and dendrinoids, are seen. In type 1B, formation of calcified tissue in the lumen of the cyst wall showing dystrophic calcification, and proliferation of tissue is similar to ameloblastic fibroma. And in type 1C, ameloblast-like proliferation in the connective tissue and lumen of the cyst may be seen. The treatment of calcifying odontogenic epithelium is enucleation and curettage, and it also depends on the site of the lesion and histological pattern. Enucleation followed by removal of 1 to 2 millimeter layers of bone around the edges of the cystic cavity with a sharp curette or bone burr ensures that there are no remnants of the epithelial lining remaining in the lesion site, thereby decreasing the chances of recurrence of the cyst. The prognosis of calcifying odontogenic cyst is favorable and it has minimal chances of recurrence after simple surgical removal. Epidemiology of this cyst has shown that 65% of cases are found in the front of the mouth in the incisor and canine region, and it may occur in individuals aged between infancy to elderly, but average age is 33 years. And there is no correlation between gender and race because it can occur in any individual. So here we come to the end of this video. Thank you for watching and do subscribe to the channel if you find this channel useful for you.